Now that we know what acute leukemia is and what the classifications are, then what are their clinical features? The onset of AL varies, may have a sudden high fever similar to a cold or severe bleeding, and the slow onset of AL is often pale, skin purple, menorrhagia or continuous bleeding after tooth extraction. The predominant symptoms and signs are the consequence of both bone marrow failure and immature blastic cell growth. The first step is to replace most of bone marrow cells, crowding out normal hematopoiesis. The symptoms include fatigue because of anemia, easier bleeding because of the thrombocytopenia, and more frequent infections because of the leukopenia. Pain and tenderness in the bone can occur when there is an increase in cell production, which causes the bone marrow to expand. The second step is to enter the peripheral blood. The increase of blood can cause leukostasis. The third step is to metastasize throughout the body and settle down, such as the palpable hepatosplenomegaly and lymphadenopathy. Well, leukemic blast cells circulating and enter most tissues in small numbers. Occasionally, biopsy or autopsy uncovers marked aggregates or infiltrates of leukemic cells. Collections of such cells may cause functional disturbances. Extramedullary involvement, especially the organomegaly, is most common in M4, M5, and ALL. Skin involvement may be of three types: nonspecific lesions, leukemia cutis, or granulocytic myeloid sarcoma of skin and subcutis. Skin involvement preceding marrow and blood involvement to relapse occurs, but is rare. Sensory organ involvement is very unusual, but retinal, choroidal, iridial, and optic nerve infiltration can occur. Otitis externa and interna, inner ear hemorrhage, and mastoid tumors with seventh nerve involvement may be presenting signs. The gastrointestinal tract may be involved at any point, but functional disturbances are unusual. The mouth, colon, and anal canal are sites of involvement that most commonly lead to symptoms, including infiltration and infection. The respiratory tract can be involved by infiltrates or tumors, leading to anterior mediastinal thymic mass, laryngeal obstruction, parenchymal infiltrates, alveolar septal infiltrate, or pleural seeding. Cardiac involvement is frequent but rarely causes symptoms. Symptomatic pericardial infiltrates, transmural ventricular infiltrates with hemorrhage, and endocardial foci with associated intracavitary thrombi can occasionally cause heart failure, arrhythmia, and death. The urogenital system can be affected. Unilateral pelvis enlargement of the scrotum can be a sign of testicular leukemia cell infiltration or hydrocele, the latter resulting from a lymphatic obstruction. Osteoarticular symptoms may occur. Bone pain, joint pain, sternal tenderness, and bone necrosis can occur, and rarely arthritis with infusion is present. Central or peripheral nervous system involvement by infiltration of leukemic cell is very uncommon, including headache, vomiting, altered mental function. Although meningeal involvement is an important consideration in the treatment of the monocytic type of AML and ALL, especially in children and hyperleukocytic patients. Liver, spleen, and lymph nodes are the most common sites of extramedullary involvement in ALL, and the degree of organomegaly is more pronounced in children than in adults. In addition to the above, let's focus on two concepts of skin involvement. First, myeloid sarcoma. Synonyms: granulocytic sarcoma, chloroma, myeloblastoma, monocytoma is a tumor composed of myeloblasts, monoblasts, or megakaryocytes. The tumor may occur as an extramedullary mass without evidence of leukemia in blood or marrow, so-called non-leukemic myeloid sarcomas, or in association with AML. Biopsy specimens are positive for chlorhexidate, esterase, lysozyme, myeloperoxidase, and a cluster of differentiation CD markers of myeloid cells. Abnormalities in chromosome 8 are the most frequent cytogenetic disturbance in myeloid sarcomas. Systemic chemotherapy, rather than local therapy, should be used for treatment, although the long-term outcome in such cases usually is poor. Second, Swiss syndrome, known as acute febrile neutrophilic dermatosis. It's a rare skin condition characterized by fever and painful skin lesions that appear mostly on arms, neck, head, and trunk, sometimes associated with cancer, most often leukemia. Thank you.